everyone, welcome to our channel. You guys may recognize us already from TikTok as Team Jocelyn. We had a lot of you guys on TikTok want us to create a YouTube channel, so we're gonna try it out. Today we're gonna sit down and talk about Jocelyn's story in more detail of everything she's been through, what's coming, what's next. I get a lot of questions about what Jocelyn has been through, so I think this is the easiest way to just kind of explain everything. Basically, I think we'll just get into everything from the beginning and how we found out, the symptoms that she had, and everything that she's gone through. So do you want to talk about what symptoms she was having beforehand?
You know, she was throwing up like every morning, sometimes twice a day. She also was feeling extremely tired.
Normal 17-month-olds usually are pretty active, and Jocelyn was really lethargic and really tired most of the day. She would sleep about 10 to 12 hours a night, and she would wake up in the morning and just instantly want to lay on the couch and sleep again.
I even remember there was one time I brought her outside because it was April time frame, and all she did was lay outside on the floor, on the ground. That's all she did.
Yeah, and her daycare, when we would pick her up in the afternoon, they would tell us that she would go outside, and while the other kids were playing on the playground, she would just be laying there. Or even when they were inside playing, all of the kids would just be trampling over her, and she would just be laying in the middle of the floor wanting nothing to do with it. So she was just really tired all the time. She was dazed. She had like a dazed look, and she was just out of it. Part of which we didn't realize this was a symptom until after, one of her eyes started becoming a little lazy, and her smile, when she would smile, only one side would go up. And we found out after that it was because of the tumor. Most of you guys already know who Jocelyn is, but for those of you who don't, this is Jocelyn.
Pretty much just led us into going into our her pediatrician, like, I don't know, what would you say, like once a week or once every other week?
No, it was, we had went into her pediatrician at least once a week. It was 1 to 2 times a week within the month that her symptoms started.
Yeah. Well, anyway, so they tested her blood, which came back completely fine. They did a strep test on her, completely fine.
They did a diabetes test on her.
They did a urinalysis on her. Nothing. Everything was perfect.
But, so they did all of these tests, but it was 3 appointments in for her going to the doctors. Prior to them starting to do any sort of test whatsoever, her pediatrician kept brushing it off that it was the flu. And she had stopped throwing up for a couple days. And it came back, so he brought her back to the doctors again, and he said, it's just another strain of the flu.
Right. Which at that point we were getting really frustrated because we know what it's like. I mean, just about everybody know what it's like.
She didn't have the flu. Yeah, she didn't have a fever. She didn't have anything digestive wise, like diarrhea, anything. It was literally just throwing up and her being really tired. That was it. So the whole thing didn't make sense, and it was really frustrating with them to keep brushing us off. Eventually, I think it came to, we brought her in twice in 1 week because we were like, this is ridiculous. Nothing's getting better. We need more testing done. And so they finally agreed they were going to do an MRI because they thought maybe she had built up fluid and pressure in her head. So they wanted to see.
Remember, she's
if the MRI didn't show anything, they were going to do an ultrasound of her stomach.
Right.
So finally we got to the day of the MRI, and so she went in, they did the MRI, everything like that. They said it was going to take an hour and a half, I think it was. And I want to say 2 hours went by. And one of the nurses came out and she was like, oh, we're just finishing up. We got to do a few more things and then you guys can go back and see her. So eventually they said that they were ready for us to go back and see her. They said there was a finding on the MRI that we needed to talk to a doctor on the phone from primaries. So they brought us into this little room and they said, all right, this doctor is going to call you guys and she's going to let you guys know what's going on. And then you took the phone call, so I'll let you kind of explain what happened.
Yeah, I took the phone call, and it's actually kind of hard to remember everything just because it was such a blur. But I remember like picking up the phone, talking to an oncologist down at the hospital down in Salt Lake City. She was saying like who she was and everything, and when she said oncologist, Very first thing, I was like, I don't know what that is. Um, I I never really knew what an oncologist was, but after talking to her and she was saying like, oh, Jocelyn's got a mass in her head, and at that point I was just kind of in shock, like our kid, like a mass.
So I think we were in shock too, because when they brought her back for the MRI, we had gone out to the car and we were talking about how we thought this was pointless. We didn't think the MRI was going to show anything whatsoever because we thought it was something stomach related. Right. We had flat out said to each other, this is stupid, this is a waste of time. Like, we don't think anything's going to come from this.
Lo and behold, here we are. What did they have us do? They had us like run.
So they wanted us to be rushed down by ambulance. Right. They were telling them, we're going to have you come down by ambulance, blah, blah, blah. And we're like, we don't understand why, because she seems fine. Like, she was fine this morning. Why do we need to be rushed down to this hospital that we've never been to by ambulance?
Yeah, and also I think it's because, like, once you give that kind of news to parents, they probably don't want you.
They didn't want us driving. Yeah.
Just because your mind's going to be in a completely different place at the time.
We did talk them into letting us drive down there, because once we got down there, we had no idea how we were going to get home. So eventually we got down to the hospital and we had to go straight to the ER, and that's when we just started meeting with a bunch of different doctors. And they were just talking about, she has this tumor, it's this mass, and just all these things. And the day in itself is kind of still a blur because, for one, it's such a shocking event.
Yeah, but we were also like rushed everywhere.
Yeah, and everything was happening really, really, really fast. So then eventually I remember we met with this guy. He came in, he's like, okay, I'm a neurosurgeon and we're going to do surgery tomorrow. We're going to do a biopsy. We're going to find out what this is. We're going to do surgery. And they explained to us that the reason why she was throwing up is because she was getting really bad headaches. And the headaches were causing her to throw up. She was getting the headaches because the tumor was blocking the draining port of her brain. So all of her spinal fluid was building up in her brain. Right. So that's why she was getting the headaches. So this guy comes in and he's telling us about how they're going to do a biopsy. They're going to attempt to take it out depending on what the initial biopsy comes out as. And then they're going to place a shunt to relieve the pressures on her head so it relieves her headaches. I remember his mom asked the question of, so is the biopsy going to determine if it's benign or malignant? And he had looked at us and said, oh, it's definitely malignant. By looking at the scan, I can tell you 100% that it's cancer. Literally the very next day, Jocelyn got admitted that night. And the very next day, she had her first surgery. They ended up not removing the tumor because they were afraid that without doing treatments prior to removing it, it would have been too dangerous.
Right. Just for blood flow.
Right, exactly. So they ended up just placing her shunt, doing a small biopsy, and that was it. The initial pathology of the biopsy came back as an ATRT brain tumor, which ATRT is atypical teratoid rhabdoid tumor.
Right.
After all of that happened, Jocelyn was able to come home for about 3 weeks to heal up, and then she started into her very first round of chemo. Right after the first initial rounds of chemo, they ended up doing her first removal surgery. During that surgery, he was able to remove 100% of the tumor, and the only negative that came out from that surgery was she did have a minor stroke, which occurred during surgery, because the tumor itself, to put into size comparison, it was roughly the size of a golf ball, but about the size of 1/4 of her whole brain. So it was quite large. The only short-term deficit she got from the stroke was she had some weakness on her left side, so she couldn't use her left hand for about 3 weeks, and she couldn't put weight on her leg for about 3 weeks. But after that, she went completely back to normal. After the surgery, she healed up again. About 3 weeks went by, and she went into 3 more rounds of chemo. This time, it was with completely different medications. And they paired these 3 rounds with stem cell bone marrow transplants. to help boost her ANC a lot quicker.
Which is her immune system.
Yeah, her ANC is her immune system. So a lot of people ask us how long a round is. During her first 2 rounds, the chemo, so the rounds themselves would last about 3 weeks, that she would be in the hospital for the entire 3 weeks, but she wouldn't be getting chemo the entire time. So for the first 2 rounds, she got chemo for, I think, the first week. And then for the second 2 rounds, she only got chemo, I want to say, like 2 days. First 2 or 3 days.
First 2 days.
Yeah. And then after that, it was just waiting on her immune system to build back up for her to go home.
Right.
And kind of backtracking a little bit, at the end of her first round, they ended up kind of sending her into her first round of chemo too soon, and her incisions from her shunt placement weren't fully healed. So it caused an infection in her shunt line. Her shunt goes from her brain down to her stomach, and that's kind of how it drains. And so that incision site got infected. So between her first and her second round, she ended up having to go in for surgery to get that line replaced, and they ended up moving it to the other side. It's kind of backtracking a little bit, but I forgot about that until now.
Well, there's so much to talk about, like so much that happened during,
and there's a lot of like
this.
little details too that we're just kind of going over the generic stuff that happened and what she's been through.
This is like basic but not basic overview of everything.
Yeah. So her last 3 rounds of chemo, she started it the end of September, I want to say. She started her first of the 3 at the end of September, and she didn't get done all of her chemotherapy until the middle of November. And then after that was completely done, I think she had about 3 weeks off, and we ended up having to go to Seattle, up to Seattle Children's Hospital to do proton radiation.
Right, which in the beginning, both of her grandmothers, so my mom and Caitlin's mom, brought her up there to start, because during that time, the day that they left to go up to Seattle, Caitlin was giving birth to twins.
Yeah.
So
yeah. So we had a lot going on the entire last year of 2019. Jocelyn ended up going up to Seattle for 6 weeks of proton radiation, and after that, we're kind of leading into February of this year, 2020.
Right.
She ended up getting declared cancer-free on March 11th of 2020.
Right, and she rang the bell and everything, and
you can
got
see
it on video.
Yeah, you can go on our TikTok, team_Jocelyn, and see the videos of her ringing the bell.
So that was a very awesome moment, and it filled us up with a lot of hope.
I think, and I mentioned this on a live on TikTok the other night, we were very naive about the whole situation because we looked at it like, oh, she rang the bell, she's done. We're going to be done with this. We're never going to have to look back. She's never going to have to do this again. And even her doctors had always said, because Jocelyn handled her treatments really well. She wasn't sick all the time. She just handled them really, really well. And her initial 2 treatments ended up shrinking the tumor by almost half before that removal surgery.
Everything seemed to be picture perfect.
Yeah, for the way it should have went. So, and even her doctors had always said they never thought with Jocelyn that it would come back.
Right.
Typically, once someone is cleared with ATRT, for the first year or 2, you'll go in and get MRI scans every 3 months just to make sure nothing's coming up. And then after that, it'll be yearly until they're 5 years past cancer-free. So I think it was stuff with COVID ended up pushing back her 3-month scan to 4 months. So now we're in July of this year, and Jocelyn had her very first post-treatment getting cleared cancer-free scan July 13th.
Right. That's when the second time it came back.
Yeah, so on that day we were told from her doctor that her cancer had come back, and it wasn't as large, but there was still a tumor there. We were always told from the beginning ATRT patients are given a 50% prognosis rate, and then we were always told that when it comes back we have to go more aggressive with it, because it's a lot harder to treat because you start running out of treatment options pretty much. Back when Jocelyn got her tumor removal surgery in August of 2019, we had opted to allow the neurosurgeons in the hospital to do research on her tumor. And they had said that it might not help us in the future, but it could help other kids. So we're like, yeah, sure, whatever, that's fine. So in July of this year, when we found out it came back, they had said, give us a few weeks, we're gonna look at that research and try to see which medicine could work for her best. Because they said that they found a couple medicines that were tested against her tumor in the labs that we could use to treat her this time.
That worked really well on her
Specific tumor
that they took out in the first time, right? The first biopsy.
Yeah.
So Jocelyn went into her second surgery while her doctors were trying to figure out what medicine that her next chemo medicine that she'd be on. She had the surgery and everything went perfect. She had no deficits whatsoever. The doctors were able to remove 100% of it.
Yeah, so within the first 48 hours after surgery, she was sent home because she was doing really well. She was eating well, drinking well, she was walking around, moving, everything was good. So about a week after her surgery, we got a call from her oncologist telling us about this drug that they wanted to use because it was a drug that they had tested against her tumor, and her tumor was shown to have a high sensitivity to.
Right, it had a really good outcome.
Right. So her hospital here created their own trial for her, and we jumped into it after she was healed.
Right, because at that point it seemed like there wasn't really a lot of other options other than, like, they thought that was our best option, is to try this medicine that worked really well on her tumor that they biopsied to begin with. And so that was our best shot at hopefully ending this.
So the way that the rounds with this chemo worked, it was completely different from last year. This time she was able to actually stay home. It was just an oral drug. She was on the drug for about 7 days. She was off for 14 days, and then she started it again for another 7 days. Right. And so that was a round. They decided that after her second round, they wanted to do an MRI just to check the effectiveness of the drug and make sure nothing was growing back.
Right, because at this point we're already... It was
2 months.
Yeah, 2 months to 2.5 months past surgery.
Yeah.
And just in 3 months, we saw that, the tumor, if it's growing back, then we're going to notice it right off. So
we're going to notice it at that point. And yet again, there was a third tumor reoccurrence there. Yeah, so this brings us to about a month ago that they found out about the third tumor reoccurrence. So it's pretty recent. So when it came back this time, they had to kind of figure out what they thought was best, what they wanted to do, and what the next step was. So we had to wait a few days for them to sit down with the neurosurgery oncology board for the hospital. And they sat down and discussed all of the possible options. And they determined at that point, they thought Jocelyn's best option would be getting involved with a clinical trial that was going on, or still is going on, in St. Jude's. So with that being said, we would have had to pick up and go to Tennessee for X amount of time and do that. But that was something we figured that was something that we could do, and it could be done if that was Jocelyn's best option.
Right, yeah, traveling for us didn't seem really to be an issue. When we talked to St. Jude's, at this point now we're like, okay, like St. Jude's, it doesn't seem so bad. And we looked into the study a little bit. And it's not until Caitlin got a phone call, the St. Jude's neuro-oncologist?
Yeah, it was a neuro-oncologist from St. Jude's had called us to discuss their protocol that they have going on there.
And then he straight up told Caitlin that he doesn't think it's going to work and that it's not going to cure Jocelyn's cancer whatsoever.
At that point, it kind of raised a little bit of red flags for us, because we were like, well, if he's straight up saying he does not think they can help us, is it worth packing her up and going across country for this?
Right.
I ended up contacting her oncologist like right away. It was within, I think, 10 minutes after getting the phone call. And she had said that she's going to do a lot of research and try to find any clinical trials open and give us our options, just so we have tons of options that we could try to pick from and see what we think would be best for her, because she also had said that she doesn't think Jocelyn could be cured. She's not sure how much there is out there that can actually cure her. With that being said, she said, now we could find something that it's just kind of like a home run, and it works. So she's not saying 100% she can't be cured, but she's saying she doesn't believe she can.
Right.
But we're still going forth with trying any treatments out there geared towards ATRT.
And it's not that we have like a bad doctor or anything. It's just the fact of Jocelyn has already gone through the ringer on a lot of stuff. She wasn't saying it to be rude or harsh, and she's just
heartless.
Or heartless. It's just, and we're not gonna switch doctors. She's not giving up on her. It's just with this type of cancer, like brain cancer, it's kind of hard.
So it's rare to begin with, and they don't have a lot of research. So especially when it comes back, you run out of options really, really quickly. And she's just kind of like making us aware of that. But over that next day, she contacted a bunch of different doctors and just tried to find tons of options and figure out which one she thought was best.
Right.
So she ended up contacting a doctor that's a neuro-oncologist in Toronto, Canada, that she works at Sick Kids. And they do a MEMAT protocol there, and it involves 6 different chemotherapy drugs with an intrathecal chemo as well. And it's just a different chemo regimen protocol that they do there, that she kind of introduced our doctor to.
Like you said before, though, 2 out of those 6 she's already had before, right?
Yeah, so 2 out of the 6 medicines that she's going to be on are medicines that she's had before.
In the first round.
Yes, which could be a good thing for her.
Because in the first round, it really shrunk her tumor down quite a bit.
It was really responsive. Jocelyn ended up going into her 3rd removal surgery just a week and a half ago. And they were only able to get 85% of it, but we haven't really had the chance to talk to her neurosurgeon too much since the surgery yet. Right. But I'm thinking there had to have been some sort of safety risk as to why they didn't get the rest of it. While they were also in there last week doing the surgery, they placed an Ommira reservoir, which is what part of this new protocol calls for. They're going to be doing intrathecal chemo, and basically what they're going to do is inject the chemo directly into the reservoir, which is going to go directly to the tumor location. So that could be a really good thing, because that tumor in the exact spot is getting treated with chemo.
Like directly.
Directly. It doesn't have to go through her blood. It doesn't have to go through any other fluids. It's right there. We're trying to be hopeful with that, and that's kind of the point that we're at right now. Jocelyn should be starting this new protocol in a couple weeks. She has to be healed up completely first. Her counts have to be a certain level before we can even get into this. Basically, while she's on it, it's just all oral medications that she'll be able to take at home. Right. She'll have to go in weekly or twice a week to get blood work, because a big risk that develops with this is toxicity, and it can cause her platelets and white blood cell counts, red blood cell counts to tank and not want to come back up. So that's a big thing that we have to keep an eye on. And other than that, if this works, it's something that she could be on long term, like 1 to 2 years before she's even stopped or taken off of it. If it doesn't work, we don't know what the next step is. We are just going to have to
no, we don't know.
move on from there and try to find something else. While she's on this, I think they're going to be taking scans every 2 to 3 months just to check on regrowth also. Right. But yeah, that's pretty much everything Jocelyn's been through, what's to come, her entire story.
So that's pretty much it for our introduction video.
We hope you guys enjoyed listening to Jocelyn's story. We're going to be coming back a lot more, talking more in depth about different topics.
Hopefully to have some actual insight on going into the hospital, maybe, and just seeing her doctors, like if they're okay with filming. I don't know.
Possible stuff like that. We're going to answer lots of questions on here that you guys have, just more in-depth stuff, and we'll kind of dive into everything with Jocelyn more as we move forward.
And definitely we'll add some fun things that we do.
Yeah, we're going to do challenges, stuff like that.
Yeah.
We'll have all of our links down below, and we'll talk to you guys next time.
Okay,
bye.